Good afternoon.
Right. I wanted to start with a pre-warning. We are just starting to get some weather outside. I don't know if you're all experiencing the same thing. I'm in Baltimore. But if there's any interruptions, Taylor and I have a little bit of a backup plan. So if I do cut out for any reason, she'll be able to jump in with our slides. So hopefully everyone is staying safe. And welcome to the August Healthy Eating Active Living Workgroup meeting. We've got a little bit of an icebreaker for today. So please go ahead and put your introductions in the chat, your name, your organization, and if you're following the Olympics, what's your favorite Olympic sport? Or what is one sport you would like to see added to the Olympics in the future? My name's Kim Stinchcomb. I'm with the health department. My favorite Olympic sport that I've been following is gymnastics. So I'm not too original there, but I've been really enjoying it this year. And if it is your first meeting or if you haven't been on for a bit, please feel free to come off mute and introduce yourself to the group.
I can go next. I was starting to write it in the chat and then I accidentally sent my name by itself. So I'll start. My name is Kumba Senko. I work with the Prince George's County Health Department, the Health and Wellness Division under Prevention Link. Right now, my favorite Olympic sport is definitely track. And then gymnastics is definitely second. So, and swimming. And swimming.
Thanks, Kumba. I'm seeing more gymnastics, track and field, swimming. Excellent. Oh, and Michelle, yeah, I'm also looking forward to the breakdancing competition.
Yes, it starts Friday. I can't wait.
It does? Okay. I'll have to look out for that. Excellent. Well, you all can please continue putting your introductions in the chat. Today, we have a full agenda. We'll be welcoming the new director of the Food Equity Council and also getting an introduction to the Childhood Obesity Prevention Program from the Health Department. And then we'll move to any subcommittee updates and close with community announcements. Jessica, do you want to share the group's vision?
Sure, Kim, and I apologize if you were saying my name before. I was like completely oblivious. I'm like, why am I not hearing anything? Hey, so sorry. Hey, good afternoon, everybody. My name is Jessica Moy. So I serve as the co-chair for this HAIL committee, and I also am the vice president for community impact with the American Heart Association. So thank you, everybody, for joining. So the vision for the Healthy Eating and Active Living Committee, known as HEAL, our work group envisions the Prince George's County as a place where everyone has access to fresh, nutritious food and environments that promote good health, wellness, and active living. And I will go ahead and introduce our first speaker, Dr. Camille Range. I see I see that you're on, so I will let you go ahead and get started with our agenda. So she's the director of the Prince George's Food Equity Council. Looking really forward. I know we American Heart Association, we definitely used to be really involved. So definitely would love to, looking forward to hearing about the updates and what are their current, what is currently going on as far as the Food Equity Council, and how everyone, including myself, can be more involved and working with the Equity Council. So I will turn it over to you. Oh, that's all. Okay.
And I
Right.
we may
What's
maybe we
on?
can come back. Dr. Range.
Chocolate croissant.
Chocolate croissant.
I saw her name.
Okay.
Maybe not.
I don't want a regular croissant.
Maybe she got bumped off. And please remember, everyone, if you're not speaking, to mute. Okay, we can come back around if she's able to join
Okay.
later. And we can go to our next presenter.
Awesome. All right. Kumba Sanko. Please
Yeah.
forgive me if I'm mispronouncing your name. I'm so sorry if I please pronounce your name correctly if I mispronounce. My last name
No
is
problem.
Moise. Everybody, I go from Mose to so believe me, I'm used to it. But please pronounce your name for everybody if I mispronounce it. I will let
No
you.
problem.
I will let you begin.
No problem, no problem. So, hi everyone. Thank you for having me today. My name is Kumba Senko. I am a registered nurse. I am working with Prevention Link under the Prince George's County Health Department, the Health and Wellness Division. I am going to do a small presentation on our childhood obesity prevention program that we are planning to launch this fall. So you can stop me along the way if you have questions, but I'll also open the floor up for questions at the end. Okay, so I'm just going to share my screen really quickly and come over here. All right. So the program that I am going to be talking about today is a family-based behavior treatment program. Our designated program title is Prevention Link Family and Kids. So if you hear me refer to either one of those titles, I'm referring to the same thing. It's just the technical name known by the CDC, and then our personalized name that we're going to call our program. Okay, these are just some disclosures about, some of the information within the presentation is from, different sites from the CDC and things like that. I won't bore you too much with this information, but we'll get right into it. So the family-based behavior treatment program is a CDC recognized evidence-based family healthy weight program. This family-centered intensive health behavior and lifestyle treatment program can be adapted for cultural contexts and family needs. So that means that we are basically going to be making this program as versatile as possible. We are going to be trying to accommodate families alike and address all of their cultural needs as we attend to their families. So FBT is designed to help both the parent slash caregiver and children build and establish lasting changes in behaviors by applying self-regulatory skills, behavioral economics, and social learning theory principles to practice of weight maintenance across multiple social environmental contexts like home, school, community, and work. As we know, that's where majority of us spend most of our time, and that's where the children spend a lot of their time. So we want to make sure we're addressing as many of those environments as possible. Prevention Link Family and Kids, specifically related to the Prince George's County Health Department, is going to be rendering to families who have children in the age groups from 6 to 18. We're going to emphasize healthy eating, physical activity, and positive parenting. We want to empower families to practice new behaviors in a variety of settings so they can sustain healthy changes long term. So I'll talk more about how we plan to do that and how we plan to address each of those areas of health. But ultimately, our overall mission and vision is going to have families achieve realistic health behaviors. We want to see a reduction or stabilization of the child's weight. We want to see a reduction or in the parent slash caregiver's weight or BMI. We also want to see, alongside the weight change, possibly we want to see improved nutrition, physical activity, and associated behaviors. So just their entire outlook on health. We want to see improved health-related quality of life, including self-esteem. As we know, that is a huge problem within the pediatric population is how they view themselves, especially when they may not be satisfied with their physical appearance. So we want to make sure that we are addressing those areas as well. We want to see improved metabolic markers such as blood pressure, lipids, and insulin sensitivity. There's times where weight may not reflect what the lifestyle change has implemented, but sometimes when we see those biometric markers such as cholesterol, blood pressure, and A1C, we get to see that the body is actually changing and achieving those health goals that we are looking for. We want to see improved parental stress, self-efficiency, and ultimately quality of life for the entire family. So we want to see that overall holistic approach and make sure that the family is just overall, in a better space health-wise. When we talk a little bit about prevalence, and I'm sure we're all aware that, childhood obesity at this point has reached an epidemic level in the United States and is widely considered a public health crisis. The World Obesity Federation predicts that the number of school-aged children and adolescents with obesity will rise from 150 million worldwide to 250 million by 2030. And so you can imagine the increase and significant burden that this will place on healthcare and social services as the population ages, because what comes from obesity, here it is, chronic diseases. So obesity in childhood causes health conditions that were previously only seen in adults. So things like hypertension, cardiovascular disease, high cholesterol, type 2 diabetes, fatty liver, joint problems, infertility, depression, suicide, breathing problems, all of these things that once were only seen in adults are now being more prevalent in children. And so if you know much about chronic diseases, you know that that's not anything that we want children to have to deal with. It's very complex in its nature, and it's just, it's just not any person it's difficult for. So you can only imagine a child first having to understand their circumstances and then further deal with what, has come from a very preventable situation. So this is why we really are working our best to make sure that we are kind of addressing childhood obesity. When we talk a little more about prevalence, as of 2023, 1 in 5 children in the U.S. are obese, and this number is rising yearly. Maryland ranks 16 in overall prevalence, with 28.8% of children considered either overweight or obese. Our program is going to be initiated and initially only offered in Prince George's County. We do plan to expand, but initially, we are going to target the Prince George's County population, and here's why. Prince George's County alone has almost 50% of school-aged children who are overweight or obese. So, that is just extremely high. So that's just to consider about half of the pediatric population in this county are either overweight or obese. So we want to definitely see if our program can somehow impact these percentages, and the next time that this data is pulled, that possibly we'll see a decrease after a year, 2 years, 3 years as the program continues to be offered. When we talk about the inclusion or what is needed in order to participate, we are looking for pediatric ages between 6 to 18. Both the child and the caregiver must reside in Prince George's County. They must be receiving pediatric care from a provider practicing in Prince George's County who agrees to participate in PLF and K, and I'll tell you why we need the provider to be involved. The child must be diagnosed as obese or overweight, and that is signified by being at the 85th percentile or above on the growth chart for weight. And then the caregiver must agree to participate in PLF and K alongside their child. So although the child may be 17, 18, 16, and they can very well comprehend the material, we want that family approach that's going to be pivotal and very important. So we're going to make sure that the parent is also well aware and agrees to be a part of the program as well. The 3 providers that are going to be the main interventionist in this program, you're going to have a behavior health provider. So that behavior health provider is going to be the FBT interventionist. They're going to be giving 4 hours of individualized family assessment and or therapy with their, and then they're also going to be giving 22 hours of FBT, which is the family-based behavior treatment, which is offered within a group setting. So that's going to be 22 hours. And I'll show you the breakdown of how we're going to get to that 22 hours. But what I like about this program is that they give you that individualized family support. They're going to get 4 hours. It's going to be individualized so the family can really address their needs. They're going to use it to target parenting skills and behavioral things that they do in their home. And basically it's going to be personalized to that family and their needs. And so it's a form of therapy that is used to address their health needs. They're also going to have a dietitian who's going to be offering 2 hours of individualized medical nutrition therapy, 1 hour in the first 6 months and 1 hour in the second 6 months. This is modifiable. So in the event that the family is not making progress effectively or we're not seeing the changes, they are going to have the opportunity to meet with the dietitian more frequently. But as a standard, each family is going to get 2 hours of individualized medical nutrition therapy. That way they'll have a space where they can customize their nutrition plan and, see how they're going to attack the first 6 months, reassess in 6 months to see how that that plan worked. And then if it didn't work or there's some modifications needed, then they'll be able to modify their plan at that time. They're also going to have access to their primary care provider, which is why we said they have to agree to be a part of the program as a provider with their patient. We're going to ask that the provider follow up with that family every 6 months. They're checking for improved weight status, decreased BMI, weight stabilization. They're also going to possibly check the metabolic markers that we had mentioned. That's going to be up to the discretion of the provider, but we're going to highly encourage them to do that. But they're going to have a check-in with that primary care provider every 6 months. And then we're going to give the primary care provider feedback on how their patient is doing along the program on a monthly basis. So that way they'll have data to look into before they meet with that family to make sure that, we're all on the same page, and then they are able to effectively reassess that family. Okay, so when we talk about the curriculum will be disseminated across the 12-month period. So this is a year-long program. As you guys know, lifestyle changes are very difficult and they require, it takes a lot of time to build habits. So we want to give the family that space to know that we're here to support them throughout the year, and that, throughout that year, we're going to constantly be learning new skills and how to improve our overall health goals and outcomes. They're going to have 2 1-hour virtual group classes that'll be hosted by the FBT interventionist per month. So that's how they're going to get to that 22 hours with their FBT provider. They're going to have group sessions that are 1 hour long twice a month. And each of those classes will focus on one of the topics listed above. And also to mention, since we are, targeting ages 6 to 18, we are customizing the curriculum to fit different age groups, and we will be grouping cohorts together that have similar age groups. So that way, we have an elementary level, middle school level, and a high school level when we are disseminating the information. And so that'll be different for every family as well. The participants will also have access to class materials such as videos, games, handouts that they can utilize or go over during their time outside of the session. Okay, so when we talk about expectations, tracking, and follow-up, we are going to ask the participants to submit biweekly weights. That's for both the caregiver and the child. It's not to it's no expectation. It's just for us to be able to have data to reflect the work that we're doing. We're not putting any pressure on the family to make sure that the weight is coming off, but we want to make sure that we are just kind of tracking the progress. We are possibly going to be using RPM, which is remote patient monitoring, where we'll where we would be providing scales, one to each household, where we would be getting real-time data back to us as they get on the scale. That way we're not just taking word of mouth. We are actually getting legitimate data. We're going to ask the families to attend all sessions, whether that's individualized sessions or group sessions. We will allow for makeups, but we're only accepting three missed sessions, and then you will be removed from the program if you did not schedule any makeups for those sessions. So they have 3 sessions that they can be absent to with notice, and then otherwise we ask that they attend all sessions. We're going to ask them to maintain a food journal / tracker. There's going to be different opportunities for them to utilize the tracker, whether it's going to be picture. They can have the option of submitting a picture. They can have the option of tracking it by hand, or they can use an AI app where they can scan their plates and it'll provide a summary. So we'll have different formats for them to utilize food tracking, because I know that's hard to stay consistent with, but we're going to try to ease the burden on that. But that's going to be essential. We want to see an increase in fruits and vegetables as the household continues to move along the program. We want to see them introduce new fruits, new vegetables into their diets, and making sure that they are, implementing the things that we are teaching along the way. We're also going to ask them to submit physical activities done per week for the child and track activity minutes for the adult. We are collaborating with Parks and Rec to, assist them with finding outside activities. This is a fully virtual program on our end, so all the services that we will be rendering will be virtual. However, we are partnering to make sure that they have opportunities for in-person activities. So where spaces they can go to their recreation center, they are going to get their personalized prevention link FBT recreation card. That's a collaboration we've already established with Parks and Rec, and they're going to give them a summary of all of the incentives that they have as a family by being a part of FBT that they can now utilize within the recreation center. For the child, they'll be able to register for one free sport throughout their program, and they'll also have access for the parents to utilize the gym within the facilities free of charge, and they'll also be keeping us abreast with all of their community events that they offer, so that way we can keep the family up to date with things that they can do during their free time. We're going to allow the providers to have access, like I said, to track their participants. We are using Epic. So we will be tracking attendance, weight, and we'll be having progress notes from our individualized sessions. So they will be able to have access to those reports. So that way they'll have an update on how their families are doing. And then it'll be something that we share across, all of our providers that work with that family. Prevention Link Family and Kids, we have a goal of 500 families per year. It's a very ambitious goal. We want to shoot for the moon and land on a star. So we're definitely going to try to achieve that goal. It doesn't mean we're going to sacrifice our quality. We are going to keep a rolling admission. So we're going to continuously be accepting families as long as we can support the cohorts. We're going to keep the cohorts small and intimate. That's just to have better rapport, better retention, and a more, inclusive space where people can share and, create a community within their cohort. So the cohorts are going to be 2 to 10 families per cohort. And with that, we ultimately want to become the childhood obesity referral source for as many pediatricians, family medicine providers, school health-based clinics, and community healthcare settings in Prince George's County. We want to be the gold standard for childhood obesity prevention. That's going to be our, one of our goals. Just to give you an overview of how the program will run, and it'll be a lot more intricate, but this is just a vague kind of brief way of kind of visualizing what that family will go through. When we receive the referral from our referral source, we're gonna do an initial intake where we will talk with the family, get all of their demographic information, make sure that they are aware of what they're signing up for, making sure that they we have discussed with their provider, we have all of our consents and everything. Will then address any barriers, whether that's access to internet, food insecurities, anything that basically would prevent them from, being successful in the program. We want, we want to make sure that we are really, doing our best to set them up for success. Then they'll have their initial enrollment session with their FBT provider. That'll be one of the 4 hours that they have with their FBT provider. In that hour, they will meet with the family, do that first session of behavioral therapy, set goals and prepare the family for their 12-month period that they're going to be going through. After that, they're going to schedule their dietitian session to do that initial nutrition therapy so they can get their nutritional plan before they start the program, and just kind of getting them ready and in the mindset of what they are about to go through. And then they'll begin their program classes with their FBT provider. So that's the sessions that are twice a month for 22 sessions. So they'll start that. At the 6-month point, they'll check in with their PCP to get progress and weights and biometrics, all of those things. And they'll also check in with the dietitian to check on the plan and see how it's been going, see the progress, make adjustments, and be prepared to continue on in the next 6 months. At the 12-month period, they'll check in with their PCP, get that endpoint data for us, so we can get a full scope of everything that's transpired over the 12 months and see how the family has progressed. And then ultimately they would graduate from the program, and they will be well prepared to be self-sustainable and implement those lifestyle changes independently. So that is it. I know there was a bit much, but let me open up the floor for questions. Uh-oh. What happened? I'm trying to. Oh, wait a minute. Okay, sorry. Let me stop sharing. Am I still sharing?
I can still see your screen. Yep.
Okay, there it is. Okay, the computer was acting crazy. All right. Anybody have any questions about FBT? Anything for me?
I have a question. This sounds like a great program. And I love that you have the partnership with Parks and Rec for focusing on active living as well. So once a family finishes their 12 months in the program, do they still have any level of access to some of the resources that so the gym and it sounds like they're using an app to track their food intake. Will they still have access to those resources?
Yes, so that's what we are actively working through right now, is what happens to the family after the program. So we're trying to see what we can maintain. We'll definitely allow them to have access to us as providers, but in addition to that, we have the relationships with Parks and Rec. We do only have that for the tenure of them being in the program, but we'll try to see what we can sustain as they progress through. I did have a meeting with a representative from Giant Foods, a nutritionist, and she enlightened me about lots of things that Giant Foods offers already, and so that allows for them to have we're working on things that is already available to them that they now are knowledgeable of and have as a resource to use when the program is over. Mm-hmm.
Excellent. Yeah, I don't know if you talked to Leslie. Leslie,
yeah, it was Leslie.
Okay, yeah, I think I saw her on
it
before.
Was me. I'm here. Yeah, we're happy to participate. The Giant team is loves this type of programming, and this is really why we do the work we do. So we're here to support you, as I mentioned yesterday. So
yes, thank you so much, Leslie. Anyone else have any questions?
How can we help you? How can we help you promote? So if I know you're looking for 500 families, are you primarily going through Prevention Link and online registration, or are there other routes for us to get referrals?
Yeah, so we are accepting referrals from all directions. We are collaborating with the schools right now to see if we can, attend back to school nights. We're doing the back to school drive. We have collaborated with another program that is in 9 elementary schools called Brighter Bites. They are a nutrition-based program. We're gonna attend their food distribution days where we can, inform families about our program in addition to. We're collaborating with another program called Hazel Health. They work as an urgent care system within the health room. So they're going to be helping us identify and sending referrals from there. We're also promoting on other MCO websites. We're collaborating like with Maryland Physicians Care. They're pulling reports to see like families that qualify. And we're going to do a webinar for their providers that have those patients so that we can, see if we can get the referrals from those angles. But if you have anything that you can share with us in ways that we can promote, we do have several flyers that we are constructing, some of which are going to be disseminated through kids' backpacks during back to school, some of which that we want for social media, others we have for, adult information or even just for providers. So whatever connections you guys have, we're definitely open and, really, looking for spaces that we can advertise.
Thank you so much. Any other questions?
No questions. Okay, so I will send Kimberly, I'll send you over all of the marketing material that we have. And if you guys have spaces that you can share, or if you know of patient populations that would benefit from this program, we do have a referral system open through CRISP. I don't know if you guys have access, but you can submit a referral through there. You can also submit a referral through the website, the Prevention Link website, and you can always call, email. I'll put my email in the chat. If you just happen to encounter anybody, please share our information. We are looking for 500 families. So, just keep us in mind if you encounter any of those spaces.
I'm sorry, I had one final follow-up question when you talked about referrals. Are the services available in any other languages or are they translated in Spanish?
Yeah, so we're translating the program into Spanish at this time. But other languages like French or Chinese, not just yet, but we are working through, those things. So if it comes up as a concern, we have ways of overcoming those barriers. So any language, any culture is open right now, and we'll just address it as it comes. Yeah.
Awesome. Thank you.
No problem. Thank you all for your time. I'll be here.
Excellent. Okay, well, I saw Dr. Range joined, so I want to give an introduction from Prince George's County Food Equity Council. Dr. Range is now the director of the Prince George's Food Equity Council. She's Sustainable Food Systems Leader in Washington, D.C., and as a community-based dietitian, she gained an understanding of the impact of social determinants of health and the high demand for culturally relevant health education. So we're really excited to welcome Dr. Range to our Food Equity Council. So we wanted to give an opportunity for her to introduce herself to the HEAL group.
Thanks so much, Kim, and for the invite. And it's so nice to meet all of the HEAL members. Meet you, and I hope that ultimately, if your work does interwork or interconnect with the Prince George's Food Equity Council, I'm sure that I will also be meeting you kind of one-on-one. I just started back July 1st, so only about a little over a month in. So looking forward to meeting everyone, in and around the county. But yeah, I just want to take a few minutes to just share a little bit, more about my background. As Kim said, I am a dietitian by training. I was originally actually from Chicago, moved to Houston, Texas, where I worked really directly with Mexican American families, but ultimately that's kind of where the rubber met the road for me in public health and connecting my research to the actual policy. And so that's what got me to DC. I was working for the First Lady Michelle Obama and her Let's Move campaign back in 2015, and ultimately really liked the DMV area and stayed in DC. So I've been here since about 2016. And in my experience, just as a community, I refer to myself as a school and community dietitian. I first was working with George Washington University and their community-based programming, then went over to Sodexo, which is a food service management company, to work in their schools segment. And so that was me being a regional dietitian for over 150 school districts that were from New Jersey all the way down to Virginia. So yeah, so my passion is definitely within school and community and that out of school time and those inner calendar times between where we are able to make more opportunities for nutrition and health education. I then worked at Martha's Table, if you guys know, have heard of the nonprofit based in DC, as their first organizational dietitian before coming to the Food Equity Council as a director. So with that being said, just bringing like a wealth of knowledge from my experience on the ground, like I said, both in the community and schools, but really tying that to my passion as it relates to the food policy work, as well as being able to fund our food, our nutrition education and health programming. So really excited to be with the FEC. I'm just going to share my screen really quickly. If you haven't heard of the FEC, it'd be great for you to just check out our website, which is pgcfec.org. I have it pulled up here. And so definitely go on and check out, learn more about our work. But one thing I just wanted to point out while I was here, we ultimately have a couple different working groups, and those really do change and rotate when it comes to what are the priorities within the county and progressing food justice within the county and the state. So I will say that we do have working groups right now. If you check on, excuse me, if you go to our work, you can read about those and whether that's actually our urban agriculture working group. We ultimately also are in the process of starting up a working group that's going to be focusing more on school nutrition in Prince George's County, as well as a working group that's focusing on food in jails in Prince George's County. So these are the three that are most active right now. But I will say when you go to our website, it'll be great if you are interested to join a committee. Just up at the top, click that button. Join a committee, and you'll see the list of the committees that are available. You can check more than one if you're interested in our work groups usually meet about once a month. I know that I think I saw Taryn and Leslie were on here, and they were, leading a lot of our food is medicine work group work previously. So I just wanted to share that as a means of if you have, maybe it's been a while since you've re-engaged with the FEC. So this is an opportunity for you to go in and just update your interest and involvement. So that's one way you can get involved. Another is if you're actually interested in serving on the FEC in Prince George's County, we are or will be having some members who will be rolling off this fall. And so we are looking for those who are interested to get more involved, maybe at a deeper level when it comes to serving on the committee. We are in the process of updating our governance document. So really being able to articulate how much time, it would take per month. We do expect our council members to lead work groups and efforts. So maybe, you've seen a working group topic that you're really interested in or aligns a lot with your work, and it would just make sense with your work or maybe your passion to join the FEC. So just want to share those two different opportunities for you to just share your information, get involved. I also want to I will go ahead and throw my email in the chat. So again, if you are interested in connecting with me one-on-one, as it relates to maybe your, whether you're a resident and you're interested and want to share some concerns, or if you ultimately are working with an organization that does serve Prince George's County residents and you see a lot of overlap, would love to, like I said, I have my list of onboarding and introduction meetings, so I would love to include you. So yeah, so I will quickly do that before I forget. .org. Oh, sorry. And then my last piece is just a save the date for our next general meeting, which will be in October. Let me back up, sorry. Our PGC FEC like general meetings are once a quarter. We previously had a meeting at the end of July, I think July 22nd. And so if you are interested, I want to just go ahead and share the date for our next meeting, which is October 22nd. And those usually are from 3 to 5 p.m. And so if you do go on and, get involved, you'll obviously be on our listserv. But I also will, all the actual dates are on our website, in our calendar. But yeah, so save the date for October 22nd at, what did I say, 3 to 5 p.m. There you go. So thanks for, again, the opportunity to introduce myself, Kim, to the HEAL group. And yeah, I'll take any questions if anyone has them as it relates to, maybe you have a question for me personally, and about my background, or how I can share more about what the FE, or like I said, or if you have a question about the FEC and the work that we will be doing to close out 2024 and looking into the next year. Checking the chat to make sure I didn't miss any questions. Nope.
Well, thank you so much for joining. I know
Yeah.
there will be a lot of opportunities for collaboration, so I'm excited that you were able to come on and just present to everyone and let's tell them that the FEC is moving and they can get involved. We'll make sure to add this in our notes as well, your website and information for people to follow up on.
Yes. Thanks so much, Kim. I really appreciate it.
You. All right, I am going back to our slides. And now we have time for community announcements. Jessica, I'll pass it to you for the American Heart Association Heart Walk.
Sure. Thanks, Kim. So I just wanted to make a very, very quick announcement. We are gearing up for our annual Heart Walk, one of the largest walks in the area. In the past, we've had over 10,000 people attend. It's at National Mall. It's going to be Saturday, November the 2nd. We are in the recruitment phase of teams. We are looking at community teams and companies, organizations. And when I say teams, community teams could be a family, could be a faith-based organization like a church, could be a community-based organizations, whatever. It could be a neighborhood. There's obviously no registration fee. We just want people to come down there and walk. It's a great day. We're always hoping for great weather. That is the actual, please, that's the website with the QR code. I know we'll send it out so you can actually scan it at your will. But also, if you have any questions, feel free to contact me directly. I can put you in, and I will get with our lead for community teams if you are interested. It's a great event. We have a dog parade. And we also have opportunities to recognize people who have made, I believe this year we always try to have awards for individuals who have made healthy lifestyle changes. So there's an opportunity to be recognized for that. So I think we're going to be having nominations for that soon. People who have made, whether it's weight loss or decrease in blood glucose or cholesterol or hypertension or like blood pressure numbers. And we recognize that we actually give awards during the Heart Walk as well. So yeah, definitely wanted to push this. It is November, unfortunately, as we know, it's just around the corner. August is here. So please, 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 and don't hesitate if you have any questions. Reach out to me directly or, get with Kim. She'll send it over to me and I will get whatever resources or your questions answered. So look forward to seeing everybody to come out and participate this year on November the 2nd. And that's it. Thanks, Kim.
Thank you. And our next announcement, so our partners with Kaiser Permanente are holding a community health needs assessment partner survey. We are hoping to collaborate with them. So as many of you may know, part of the role within the health department is completing a community health assessment. And then our follow-up is to complete our community health improvement plan, which we do in collaboration with the coalition. So we are collaborating with Kaiser to get some of the feedback from their partner survey so that we're not inundating everyone with too many survey responses. So we do encourage everyone to complete the survey by Kaiser. They'll be sharing their data for the partners that we have available. And that just helps us get a better understanding of what our priorities should be and who we can engage to define those priorities for the next cycle of community health improvement planning. So thank you all. And then they're asking that they get completed surveys by Wednesday, August 21st. And that is now in the chat. Thanks, Taylor. And then I think our last announcement that we have in advance is a back to school jam and health fair on August 17th at the Langley Park Community Center in Hyattsville. And that's from 10 a.m. to 1 p.m. They are still, I think actually, I'm sorry, they may be past the time where they're accepting additional people running tables, but we still do encourage people to show up for this health fair and support any of our partners and just get involved in the community. So we'll share this information, this flyer as well. Does anybody else have community announcements they'd like to share? Oh, go ahead, Leslie. See your hand.
Well, of course, I always have to give a nice plug for the Healthy Living Team services. We offer free nutrition services to the community, and please contact us. I'm putting in the chat our flyer, and you can feel free to take that and utilize that, or reach out to us at healthyliving@giantfood.com. So that's my little announcement.
Thanks, Leslie. Anyone else have any events or programs that they'd like to promote or share? And if not, in terms of upcoming meetings for this group, we'll have our quarterly coalition meeting on September 10th. Right now, we're planning for that to be virtual in the evening. And then our next HEAL work group meeting is Wednesday, October 2nd at the same time. So we look forward to seeing you all there. Well, we have a second. In terms of other updates for our subcommittees, I just wanted to update everyone. Last time we met in June, we discussed the Healthy Food Priority Areas map. We have been having some ongoing discussions around updating the map and making it ready for the best use ever. So instead of just having one level of tier for those healthy food priority areas, we're looking at making two different levels so that we can prioritize based on the previous criteria, but also expand that criteria a little bit more. What we found looking at the data is there are a lot of census tracts that are included based on the retail availability of nutritious food facilities. And then if we expand that eligibility by family income a bit, we get a lot more representation in our healthy food priority areas. So we're looking into that a little bit more. I wanted to especially thank Nicole Hall for her feedback from the Economic Development Corporation. I think that just seeing how that data is used in the community and how we can prioritize new grocery stores and healthy food facilities is important to the work. And it's great to have that feedback when we're developing the information. So really appreciate that collaboration, and hopefully we'll have some updates for you all soon about publishing this new map. Thank you all so much for your time today, and we will send out notes soon. Let me know if you have anything else to send. You can always reach out to us if you have a flyer or event coming up. You can reach out to us at the coalition email address. Have a great rest of your day. Stay safe in the weather.
Thank you. Bye, everybody.